Bismillahirrahmanirrahim. Assalamualaikum and good day everyone. My name is Muhammad Syafiq bin Zulkipli and my magic number is 14481C. Today my group will be presenting about United Nations 9 Millennium Development Goals MDGs and 17 Sustainable Development Goals SDG of IHH Healthcare Berhad. My group member consists of me, Muhammad Syafiq, Muhammad Izham, Hafizah Kamilah, Ahmad Zulfahmi and Sharizul Ukasha.
Hi everyone, I am Mohamad Sharizul Ukasha bin Hameem, matrix number 143146. Today I am going to present on the introduction part. First of all, the Sustainable Development Goals SDG, also known as the Worldwide Goals, were adopted by the United Nations in 2015 as a global call to action to end poverty, protect the environment and ensures that everyone lives in peace and prosperity by 2030. The 17 SDGs are interrelated, recognizing that action in one area have an influence on results in others, and that development must find a balance between social, economic and environmental sustainability. The SDGs aim to eradicate poverty, hunger, AIDS and discrimination against women and girls. In order to realize the SDGs in any setting, all of the society's creativity, know-how, technology and finance resources are required. The Millennium Development Goal consists of 8 goals, which is eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, combat HIV, AIDS, malaria and other diseases, ensure environmental sustainability and global partnership for development. Besides, the Sustainability Development Goals consist of 17 goals, which is no poverty, zero hunger, good health and well-being, quality education, gender equality, water and sanitation, affordable and clean energy, decent work, economic growth, industry, innovation and infrastructure, reduce inequalities, sustainable cities and community, responsible consumption and production, climate action, life below water and life on land, peace, justice and strong institution. 17. Finally, partnership for goals. That's all from me. Thank you.
Okay, so for question 1, we need to determine and identify the skewness of the company in IHH Healthcare Berhad, whether the activities throughout the year are towards the social stance or environment stance with the guidance of MDGs and SDGs. Hi, my name is Izham bin Nasharudin. I'm from Team 6. Today, I'm gonna start my part with question 1 for MDGs, Millennium Development Goals. So this is the first starting point where the company IHH Healthcare Berhad start include sustainability activities in their company. There's a lot of events happening over this year. One of them is breast cancer campaign, where in Pantai Hospital KL, they create Wear It Pink campaign. In ICRO, they make a difference for Pink Carnival and Pink Charity event in Klang. They also create healthcare education and public awareness activities where there was lectures, talks about healthcare. In conclusion, IHH Healthcare Berhad helps dozens of people regardless of their background. For the starting year of 2012, it seems like IHH Healthcare Berhad were more focusing towards social practices rather than environmental practices. Next, in the year of 2013, IHH Healthcare Berhad also applied MDGs elements as a guidance for the company to moving towards the sustainability achievement. There is not so much improvement in their CSR activities this year. They tend to continue breast cancer awareness campaign, which offer health education, prevention, early stage diagnosis, and effective treatment to improve maternal health. They also continue their charity program, A Heart for Children, which offer financial aid to children. As you can see here, the company continue to give focus on social practices where they give charity to a lot of people, but unfortunately there is still lack environmental practices in this year. In year of 2014, IHH Healthcare Berhad tend to continue on implementing MDGs in their company, but they make some new initiative for the goal that they achieve. They achieve new goal which ensure environment sustainability. Building Green Hospital is the given name by this event, which implement a fully electronic and paperless documentation system in Singapore hospitals. They also create environmental sustainability activities through student-driven environmental initiatives such as the Eco Friends Club in IMU. So in this year of 2014, the company are not only focusing on social practices, but they also take part in doing environmental practices. IHH Healthcare Berhad already plan to put SDGs element in their environmental and social practices during the year of 2015 in order to end poverty and protect the planet. Here, IHH Healthcare Berhad achieved a lot of goals, which is gender equality goals by providing rewarding careers for women. Among 60,000 employees, 7 out of 10 are women. Responsible consumption and production also one of the brightest goals that has been achieved by implementing 3R: reduce, reuse, recycle, which their use of recycling bin. As conclusion, IHH Healthcare Berhad had improved a lot. We can assure that the social and environmental practices are balanced.
Okay, next up we will see the screeners of IHH Healthcare Berhad at the social stance or environment stand from 2016 to 2020. In 2016, IHH still not integrate with SDGs agenda, but our group have sought the activities or event according to respective SDGs goal. In 2016, there is no disclosure on the environment activity by IHH, and for the social activities, IHH fulfilled 3 SDGs goal. IHH screeners is towards social stand in 2016. In 2017, IHH has adopted the SDG goals 2 years after SDG was introduced in 2015. In 2017, IHH still disclosed more on social activities compared to environment activities. There is improvement as IHH has disclosed the environment activities and fulfilled 3 SDGs goals that related to environment. IHH is still with the social stance in 2017. Next, in 2018, IHH still focused more on social disclosure compared to environment disclosure. IHH still with the social stance and fulfilled 4 SDGs goals that related to social and only fulfilled 2 SDG goals that related to environment in 2018. While in 2019, there was an improvement in IHH disclosure as the company added 1 SDG goal in their focus area. IHH still have more social disclosure compared to environment disclosure and more screeners toward the social stance. In IHH fulfilled 5 SDG goals that related to social and only fulfilled 2 SDG goals that related to environment in 2019. Lastly, in 2020, IHH still has more social disclosure compared to environment disclosure and more screeners towards the social stand. IHH still fulfilled 5 SDG goals that related to social and only fulfilled 2 SDGs goals that related to environment in 2020. Finally, from 2012 to 2020, we can conclude that IHH disclosed more on social activities compared to environment activities. IHH more screeners towards the social stance because IHH involved in the healthcare service and the nature of business involve a lot of interaction with people.
Greetings to everyone. My name is Ahmad Zulfahmi bin Zulkafli with matrix number 142805, and I'm going to present with our next agenda, which is question number 2, comparison the pre and post SDGs era of the social and environmental disclosures. Together with me, they are going to present the same part, which is Nur Hafizah Kamilah, Binti, Muhamad, Azmi. In Annual Report 2012, IHH Healthcare set 4 out of 8 MDGs set by United Nations. In Annual Report 2013, on the other hand, there is plus and add another 1 goal which total up their MDGs to be 5 out of 8 MDGs. In Annual Report 2014, they also set 5 out of 8 MDGs set by the United Nations. For the comparison in between the 2012 till 2014 MDGs, we acknowledge the fact that IHH Healthcare truly focuses a lot in CSR activities to contribute to the society, to benefit them in various healthcare educational programs as well as financial aid for unfortunate communities. Besides that, IHH Healthcare Berhad consistently committed in social events to hold them annually like Breast Awareness Campaign, Dream Coming True program and whatnot. IHH Healthcare began to insert the environmental activities in Annual Report 2013 and detailed their contributions towards the environment in Annual Report 2014, which brings to the goal 7 of MDG and total the MDGs becoming 5 for both particular 2014 and Annual Report 2013. We proceed to our next slide, which comparison during SDGs era 2015 till 2020. And I'm going to initiate between 2015 and 2016. In Annual Report 2015, IHH Healthcare broadened its aspiration to support 6 out of 17 SDGs set by the United Nations, UN, which are goal number 3, good health and well-being, goal number 4, quality education, goal number 7, affordable and clean energy, goal number 8, decent work and economic growth, goal number 10, reduce inequalities, goal number 15, life on earth land, and goal number 17, partnership for the goals. In Annual Report 2016, IHH Healthcare initiated adopt sustainability reporting in its annual report. IHH segregated its activities across 4 themes, which is the first one, our patients, our people, our organization, and lastly, our community. We managed to identify 3 out of 17 SDGs based on activities listed and stated in the Annual Report 2016, which are goal number 3, good health and well-being, goal number 4, quality education, and goal number 8, decent work and economic growth. The activities here in the specific 2016 Annual Report focuses a lot on its stakeholders, especially the patients, the employees, the organization, as well as the community.
Hello everyone, my name is Hafizah Kamilah, Binti Mohamad Azmi. The picture in this slide are the examples of the tables and infographics about SDGs in the annual report from 2017 to 2020. SDGs infographic were included in IHH annual report starting in 2017. In the annual report, SDG were called as IHH SDG focus areas, where IHH mainly focused on 6 SDG for the beginning. SDGs in the annual report from 2017 to 2020 were easily be recognized by IHH 5 pillars of sustainability. IHH sustainability statement in the annual report, which highlighted and segregated their social and environmental activities across 5 themes starting in 2017. In the annual report, IHH called the 5 themes as IHH 5 pillars of sustainability, which are our patients, our people, our organizations, our environment, and our community. Above table show comparison between IHH SDG focus areas from 2017 to 2020. From 2017 to 2018, IHH SDG focus area are 6 SDG. From 2019 to 2020, IHH SDG focus area are 7 SDG. IHH SDG focus area are SDG 3 Good Health and Well-being, SDG 4 Quality Education, SDG 7 Affordable and Clean Energy, SDG 8 Decent Work and Economic Growth, SDG 9 Industry, Innovation and Infrastructure, SDG 12 Irresponsible Consumption and Production, SDG 16 Peace, Justice and Strong Institutions. In 2015 to 2016, where SDG was recently introduced, IHH annual report are not yet well structured as well as with the activities or practices, but based on the donut chart above, from 2017 to 2020, the 7 SDG mostly appear throughout the years. Nevertheless, SDG 3 Good Health and Well-being has the highest practices among the 7 SDGs. Overall, the activities or practices of SDG from 2015 to 2020 seems to be decreasing since COVID-19 surfaced in the world. In Annual Report 2020, the disclosure of social and environmental practices remain active and same throughout the year. The only difference is that there is a new chapter for COVID-19 which is called At the Front Line. Not only it does not affect the disclosure of social and environmental practices in IHH Healthcare Berhad, but also improve the quality of the annual report with the current and important news to the user.
We move to the last agenda of this presentation, which is overall comparison between MDGs era and SDGs era between 2012 till 2020. IHH structured their activities in three segments, which are marketplace, workplace, and community, before planted a new segment of environmental activities in Annual Report 2013, 2014, and 2015. IHH consistent in its CSR activities and environmental elements and enhanced it for every year during MDGs era. Even though United Nations (UN) already imposed SDGs starting on 2015, IHH only began to apply it on year 2017. Annual Report 2015 still follow the format in 2014 and previous years. And for Annual Report 2016, the activities segregated across 4 themes, which are our patients, our people, our organizations, and our community. We noticed that IHH did not insert any environment elements in the particular 2016 Annual Report. Next discussion will be proceeded by Nur Hafizah.
5 themes and IHH SDG focus area were already explained in the previous slides. Continue. The reason why SDGs era has improved in environmental disclosure compared to MDGs era is that the quality of the IHH annual report are becoming more efficient, structured, and well developed. This proves that the effect of SDG goals toward the annual report of IHH is much better than before. The details in the annual report were more specific. It is to give clear information towards the user with regard to the IHH SDG focus area in the annual report from 2017 to 2020, and if it continues the same for the upcoming future, it will likely serve even more stakeholders. IHH sustainability pillars. This categorization has helped IHH expand and strengthen their sustainability disclosure and reporting framework. Overall, IHH Healthcare Berhad has explained in details and thoroughly about every social and environmental activities during both MDGs era and SDG era. Based on our readings on annual report from 2012 to 2014 MDGs era and annual report 2015 to 2020 SDG era, we can conclude that IHH Healthcare Berhad focuses their activities more on corporate social responsibility (CSR) to serve the community in these 9 consecutive years. Thank you.
In conclusion, we may infer from the examination of MDGs and SDGs in IHH Healthcare Berhad's annual report from 2012 to 2020 that IHH declared more social activities than environmental activities. IHH has a higher skewness towards the social stance than the environmental stance, since it discloses more information about its social activities. From 2017 to 2020, the practice lasted for about 4 years. The quality of IHH's yearly reports is getting more efficient and organized as the SDGs period has improved in environmental disclosure compared to the MDGs era. Besides, we were able to enhance and strengthen our sustainability disclosure and reporting system as a result of this categorization. IHH Healthcare Berhad can be inferred based on the finding provided it focus more on social than environment, which would provide a positive impact on the short term. However, it would not result positively in the long term. Besides, it might provide a negative impact on the company and even on sustainability of the world. The Sustainable Development Goals (SDGs) build on success of Millennium Development Goals (MDGs), which set specific targets and milestones for eradicating extreme poverty and other form of human deprivation. Unlike the Millennium Development Goals, which are exclusively for developing nation, the SDGs apply to all countries, wealthy, medium, and poor. That's all from us. Thank you.